an emergency in northeast Nigeria by malaria, which causes 49% of all cases and 50.1% of all deaths, perennial transmission and seasonal peaks of malaria occurs in July to November in northern Nigeria. World Health Organization, being one of the critical partners, supported the development of a framework for implementation of a comprehensive malaria response for the Northeast.
Okay, we know that malaria remains a disease of high burden in sub-Saharan Africa and in Nigeria also. Malaria across the country represents about 60% of hospital visits, is malaria related, and that tells you the kind of impact that malaria has on the nation, and also in Adamawa. We have discovered that about 25% of deaths in under 5 is malaria related, and that also includes Adamawa. We had very high number of cases coming up, especially in this period between June and November, which of course we know is at the peak of the rainy season. And talking about how it affects the economy, 44% of money spent on health is actually malaria related, and this has resulted in about 30% loss in economic growth, not just in families but also with government at various levels. As it stands now in Adamawa, we have about 20% prevalence rate for malaria, and that of course is of concern to WHO and of course the global funds that is partnering with government and with WHO to conduct this seasonal malaria chemoprevention.
The unacceptable situation perhaps led to the official flag-off of the Seasonal Malaria Chemoprevention (SMC) campaign in Adamawa State by His Excellency Right Honorable Ahmadu Umaru Fintri, Executive Governor, Adamawa State, represented by the Deputy Governor, His Excellency Chief Crowther Seth.
One of the key areas of focus to address malaria is chemoprevention to all children less than 5 years, which is why we are here today. Adamawa State Government, in partnership with World Health Organization and Global Fund, has procured and delivered to the state 3,200,850 doses of malaria chemoprevention drugs with over 1 billion naira. May I seize this opportunity to thank our partners, the Global Fund, the World Health Organization, and the National Malaria Elimination Program for their continuous investments to support our diseases interventions.
The campaign, which took place in the state capital, was later stepped down to the 21 local government areas for effective and efficient implementation and administration of the chemoprevention drugs. During a supervisory visit in Gire local government area, Benjamin Nashan, with excitement, expressed satisfaction with the conduct of the exercise.
Thank God, at least so far from yesterday up to today, the areas visited, both in Yola and around the surrounding local governments, we've recorded tremendous success. At least we've not recorded any outright rejection, and people were happy taking the medication, as in giving the drugs to their children. And we also see the enthusiasm in terms of support by the caregivers to ensure that at least they were not missed out in administering the medicines to their children. So you even see this morning in this area, Jauruguba, in Vinikiland here, you see how caregivers were even coming out to ensure that their house were not missed. Even though this morning, Sunday, some children they were in churches, but at least the parents are even coming out to like find a way how they can be able to like reach out to their children to ensure that they have taken their medicines. So it's a very good thing, and to us, that's what we are trying to achieve. At least let people take charge of their health. Let people take charge of interventions like this. At least let them show commitment. At least it will give us that zeal to do more for the state.
Similarly, the stakeholder in Vunukalang community has this to say.
Na gode wa Allah, na gode wa Ubangiji Allah madaukakin sarki wanda ya bawa wannan gwamnati da kuma hukumomi na kiwon lafiya da kawo wannan magani ga yara. Wannan abin farin ciki ne kwarai da gaske. Sannan kuma su talakawa na waɗanda suke wannan gari suna karɓan wannan abun domin shi dalili kuwa shine don kiwon lafiyansu da yara da su a wannan gari don samun lafiyan jiki. In ba lafiyan jiki lallai duk abin da kake so ka yi ba za ka yi ba. Kuma sannan waɗannan yaran mu ne. In ba mu yi musu wannan ba to kaga abu ne wanda kuma wannan hakkin yaran nan ya rataye ne a wuyanmu.
Numan Local Government Primary Healthcare Authority team, among other local government areas in the southern zone of the state, was found proactively marking house to house administering of the drugs to children under 5 years. The Executive Secretary, Numan Primary Healthcare Authority, speaks.
Yesterday we started the SMC program, and from the take-off, we observed that the program is going to be a success. Why? Because we have about 30 teams, and the drug supply to us is more than enough because we have 29,114 doses was supplied by the State Ministry of Health to the Numan local government. So as of yesterday, we started late, but we were able to cover, 10 teams were able to cover about 714 children, eligible children. That is from 3 months to 11 months, and then from 12 months to 59 months. Having a target population of about 26,467. So out of it, just yesterday around 12 o'clock we have started. We have, since we can cover about 16,600, which means by the grace of God, the program is going to be a success.
Pharmacist Katugwa Emmanuel, while in Numan, went to communities with the team to ensure compliance by target groups.
To supervise the SMC activity that is going on, that is the seasonal malaria chemoprevention campaign that is going on presently in Adamawa State and specifically here in Numan. Today is day 2, and we have come especially to this area because during the review meeting we understood that there was one case of a rejection, as you can see from this house marking, okay? So we came to try and resolve it. As supervisors and donors and senior supervisors, we have the mandate to ensure that all eligible children are administered these drugs, okay? So that they do not come down with malaria. In the long run, you see, our journey towards malaria elimination has started, okay? And it starts with you and me.
The acceptance of the SMC exercise in the state metropolitan was overwhelming as residents availed their children to be administered the drug and to be free from malaria. The community leaders respectively stressed their commitment to ensuring that children under 5 are free from malaria in line with the objective of sponsors. Dr. Iniabasi Nglas, National Consultant Malaria in Emergencies Northeast Nigeria, similarly, was on the field, monitoring and supervising strategic locations in the state to ascertain compliance and implementation of the SMC at community level by the Adamawa team in making the program going on successfully.
You are aware we are running a program specifically looking at malaria intervention in Adamawa State. We are looking at providing anti-malaria drugs to prevent malaria amongst children under the age of 5, looking at 3 months to 59 months of age specifically. And this program has started on the 10th. Today is the 5th day. I'm out here to actually see what is happening on the field. So I came here to work with a team. You can see in this household, there are 2 children within the age group of 12 months to 59 months that were actually administered the drugs. The children are healthy because the drug is meant for healthy children. We were given the drugs, and we believe that this medication will protect them from malaria in the coming months. I would say it's a huge success, being that this is the first of its kind in the state, and the level of commitment of the healthcare workers here, even the community leaders, the state government, everybody is. We are so happy with the commitment and the ownership that we've seen.
No doubt, the significance of the seasonal malaria chemoprevention (SMC), if administered appropriately, cannot be overemphasized, as it will prevent approximately 75% of severe malaria episodes and may result in a decrease in child mortality of around 1 in 1,000, thereby reducing the incidence of moderately severe anemia, reduce hospital admissions associated with malaria parasitemia, provide personal protection against clinical malaria for a period of approximately 35 days following the administration of each dose.